A kidney transplant is the preferred choice for most people with kidney failure. In this presentation, we will explore transplant as a treatment option. We'll discuss the types of transplants, their benefits, and how we determine if this is a good option for you. We will discuss strategies for finding a living donor and what to expect after a transplant for you and any potential donor. During transplant surgery, a healthy kidney from another person is placed inside your body. This is a very effective treatment for kidney disease, but not a cure. This picture shows where the new kidney is placed in the body. You will need to take medications for the rest of your life to make sure the kidney stays healthy. You will also need to meet regularly with your healthcare team. One important reason to consider a kidney transplant is to avoid the need for dialysis. People with transplants have a more normal life than those on dialysis. They live longer, have better health, and have more freedom. Most kidney transplants last for more than 10 years. There are two types of kidney donors, living donors and deceased donors. A living donor is just as it sounds. The kidney comes from someone who is alive and has volunteered to donate one of their kidneys. People can live long and healthy lives with one kidney. Someone who volunteers to donate their kidney will go through many tests to make sure they are healthy and it is safe for them to donate their kidney. In the case of a deceased donor, the kidney comes from someone who has passed away and who agreed to donate a kidney before they died. BC Transplant is the agency that takes care of all kidney transplantation in BC and makes sure that every donated kidney is healthy before it is transplanted. There are a number of advantages to having a kidney transplant from a living donor versus from a deceased donor. Transplants from living donors last longer, have a lower risk of rejection, allow better overall health, can be done before kidney failure. For a deceased donor, you must be on dialysis before you are put onto the wait list. Talk with your kidney care team about finding a living donor and the resources that are available to help you. This slide compares the steps of obtaining a transplant using a living versus a deceased donor. As you can see, the process is much simpler and faster with a living donor. The process with a living donor involves diagnosis of kidney failure, progressive kidney disease, GFR less than 15, donor and recipient assessed, transplant surgery, and follow-up care. The process with a deceased donor involves diagnosis of kidney failure, progressive kidney disease GFR less than 15, vascular access created, dialysis started, an undetermined wait time, transplant surgery, and follow-up care. Kidney transplants involve complex surgery and mean you must take anti-rejection drugs for the rest of your life. Before you receive a kidney transplant, your care team will assess whether it is a suitable option for you. In assessing you for a transplant, your kidney care team will consider the impact of transplant surgery and follow-up care for you, any medical conditions that might affect the success of your transplant, and the supports you have for staying healthy with your transplant. Many patients find it helpful to talk with their social worker about some of the issues they may face following a kidney transplant. If you are eligible for a transplant, you will be referred to a transplant team in Vancouver. Working with your local kidney care team, the transplant team will do a number of further tests to confirm that a transplant is a suitable option for you. If these further tests show you are suitable for a transplant, the next question is, where will the transplant kidney come from? A living donor or a deceased donor? If you have a living donor, your transplant surgery will take place when your kidneys start to fail. If you don't have a living donor, you will be put on the deceased donor wait list. Many people are surprised to learn that their own kidneys are left in their body when they get a new kidney. The surgery for a kidney transplant can take up to 5 hours, and after surgery, you will need to stay in hospital for about a week to recuperate. After your surgery, you will need to visit the transplant center regularly for the first month and less frequently as time goes on. Patients who live outside the Vancouver area will need to find accommodation in Vancouver for up to 3 months after their operation. When you're ready to go home, the transplant team will arrange your follow-up care at a clinic closer to where you live. There are advantages to having a living donor for your kidney transplant, but finding a living donor can seem difficult, and you may have many conflicting feelings. Some people may be confused who is a potential donor or hesitant to ask people. Others are unsure of how to go about it. Some are disappointed that no one has offered to donate their kidney. Many are concerned about the impact on the donor and fear for their future health. Some are anxious they may feel indebted or concerned about their relationship to the donor. The thing to remember is you are not alone. Your kidney care team is there to support you with information and tools to help you find a living donor and make your kidney transplant experience a success. Finding a living donor starts by thinking first of people who are close to you, your family, friends, and neighbors. Donors do not need to be blood relatives. In fact, they don't even need to have the same blood type as you. And you don't need to find someone in BC. Your donor can live anywhere in Canada. Finding a living donor is helped by using all forms of communication, including talking to people, writing letters or emails, using social media, and recruiting friends to help spread the word. For anyone thinking of becoming a living donor, it's important that they know they will be given all the information they want before committing to donating. They will be checked carefully to make sure they are medically okay to donate a kidney. They can live a normal, healthy life with just one kidney. It's important to understand the living donor must begin the kidney donation process. It starts by having them contact the living donor team at Vancouver General or St. Paul's Hospital to register for the screening process. If your donor isn't a match, they can still participate as a donor through a national program that will find someone else who needs a kidney who is a match for them. The surgery to remove a kidney from a donor is done on the same day as the surgery to put that kidney into the person who needs it. These surgeries are arranged in advance in Vancouver. After the operation, donors will spend up to 4 nights in hospital. Most donors can resume light activities within 2 weeks of their surgery and return to light work after a month or so. For full activity, they will need to wait 6 to 12 weeks. Finding your living donor well before you need your transplant is best, as it allows time for planning and organizing your life. At the time of your transplant, you will need help with everyday activities. Some donors may have access to private health benefits and employment insurance to help provide support. Most employers recognize kidney donation as a legitimate reason for missing work. There are also other programs available to help support donors, like the Living Donor Expense Reimbursement Program to help with costs, and the Living Donor Mentor Program, which offers the support of others who have previously been donors. To improve your chance of success in finding a living kidney donor, it's helpful if you provide regular communication and updates to your family and friends, invite donors to contact the Transplant Center for more information, find more than one living donor, understand that finding a donor can take some time. There are lots of other resources for both kidney transplant patients and donors from BC Transplant, BC Renal, and the BC Kidney Foundation. You can also contact the kidney transplant teams at Vancouver General and St. Paul's Hospital.